Welcome to The Other Side, Mississippi Today's political podcast. I'm Jeff Pender. I'm joined today by two of my colleagues. Really excited to have them on. Our health editor, Kate Royals.
Hi there. Glad to be here.
Thanks for coming on. And health reporter Gwen Dilworth. Gwen, glad to have you both on.
Thanks for having us.
We have a lot to talk about this session so far. There have been a lot of big health bills and related measures. Y'all have been extremely busy, I know. Kate, let's talk about one from this week that was big news. I think kind of a first, at least to make it this far. Paid parental leave bill passed the full House, correct?
Yes, it passed unanimously, the full House. And what it would do is it would give state employees 8 weeks of paid maternity leave, and fathers would also receive 2 weeks of paid parental leave as well. And this would be for all state employees, though it does exclude teachers. Okay. And this is something that's been talked about for a long time, but not really tackled, correct? Correct, yeah. There were some kind of key figures coming out ahead of the session for it. Attorney General Lynn Fitch came out in support of it, and Senator Nicole Boyd has been a champion of it as well. And it's come up, I believe, in a lot of her task force meetings she's had on women, children, and families. Okay. Again, lots of stuff to cover. Gwen, you've covered a lot of pretty big things. One thing that's been talked about in recent years a lot is changing the certificate of need laws in our state. That you may have to give us all a thumbnail of what certificate of need laws do, but tell us what's going on in that arena.
Sure. So certificate of need laws are essentially the state's health planning law. So it helps the state make decisions about what health services are needed in a community. And that prevents having duplicate services or not having enough services in an area. And it's meant to keep healthcare costs low for the state. But there's been a lot of controversy over whether the law actually does that. And there's been talk in recent years of doing away with the law entirely, but there's concern that could have risks for rural communities in particular. And so a law passed the House, or a bill passed the House last week that would kind of eliminate certain services from the certificate of need law. So it would make it easier for communities to open substance use facilities, treatment facilities. It would also allow hospitals to use their dialysis treatment programs that are currently inpatient as outpatient treatment facilities. And it would allow more psychiatric care facilities to open.
And I guess they're trying to balance this between they want to encourage competition, but I guess the worry, like you said, for rural areas is that a hospital or something would cherry pick the most profitable and not have an ER or something to that effect. So they're trying to thread the needle with this.
Exactly. And the law would also kind of streamline some of the back-end application process problems that can really hold up those applications. Oftentimes, applications will be appealed by other competing healthcare facilities, which can stall the process for up to years. And this would move things along much more quickly and offer a more definitive answer to those appeals within 120 days of a judge being appointed.
Normally, y'all, in the last few years, if we were gathered here talking about healthcare issues before the legislature, we would have started first and foremost with Medicaid expansion. Kate and Gwen both, we're kind of in a holding pattern on that, correct? With what's going on with Medicaid expansion this session?
Sure. So it's been kind of since the beginning of the session, lawmakers kind of common line is, we're waiting to see what the federal government does. There's a lot of proposals, a lot of ideas being floated around at the federal level that could significantly impact.
They range from doing away with Medicaid to you name it.
Right, yeah, to a lot of other things that would in essence, as I understand it, reduce the amount of money we would get. And so they're trying, I would imagine they're trying to be careful before expanding Medicaid to make sure they don't expand Medicaid and then have the program drastically cut or the state be on the hook for far more than we originally anticipated.
We talked briefly about this before. There's a proposal in Washington. Right now, we're in the 70-something% on what the feds pay.
Correct.
And they're talking about reducing that to 50-ish%.
I believe I've seen 50,
50s.
40% floated, and some other things like putting sort of caps on the amount that can be spent on individuals' health care, requiring theoretically the state to pick it up thereafter. So all of these things, I'm sure, are giving lawmakers pause.
Oh, yeah. I'm sure that we're talking for one of the poorest states, that could be just devastating, I guess, if it were reduced.
Yes.
The federal portion of that by that much. Yeah, again, I guess that's in a holding pattern. I've heard a lot of people say, I don't know if y'all agree, that given the way Washington's trajectory really works, I mean, it could easily be after this legislative session before we really know what's going to go on in Washington.
Sure, if they truly decide to, just wait and totally see, yes, it could be.
In the meantime, Gwen, another thing I know you've written about here recently, PBMs, pharmacy benefit managers, they're trying to tackle that thorny issue, are they not, this session?
They are, and they've another issue they've been trying to tackle for many years.
Many years, right.
Unsuccessfully. Right. And pharmacy benefit managers are kind of like the middlemen in the pharmaceutical industry. They make a lot of decisions. They also, are tasked kind of with trying to create cost savings for consumers and employers. But a lot of people argue that they're actually kind of taking some of those profits for themselves. So there's a lot of efforts to regulate them in the interest of protecting independent pharmacies in particular. In Mississippi in particular, independent pharmacies service a lot of our rural communities, and therefore, there's a lot of interest in doing something to help them. A lot of them say they might be forced to close based on the way that pharmacy benefit managers kind of control the market.
And what they're looking at doing right now, they're calling transparency they want from PBMs, correct?
Exactly. So the House passed a bill that would tighten some transparency screws. It would require pharmacy benefit managers to report those cost savings that they're earning to the Board of Pharmacy. It would also require drug manufacturers to report their wholesale costs, so how much they're spending on drugs. And the Board of Pharmacy would create a website that would display all this information. So, independent pharmacies, consumers would have access to that information. However, independent pharmacies kind of say this law doesn't do enough. All it does is make information available. It doesn't actually do anything to protect them.
Kate, another big issue, speaking of issues that have come up many times before, at least in recent years, I like saying this word, midwifery is back before us this year, correct?
Yes.
What's the issue and what's moving in the legislature right now on the practice of midwives? So
currently, anyone could say they're a midwife. You, Jeff, could say you're a midwife because there are no there are no regulations whatsoever around professional midwifery, and there's a difference, as I understand it, between professional midwifery and nurse midwifery, which if to become a certified nurse midwife, you do have to go through a certain amount of education and training and hours. So current midwives are pushing and have been pushing for years for the state to, like other states, adopt a licensure program for them. I think this would help with the value of the profession and the cost, and also ensure that people theoretically can't go around saying they're a midwife without having gone through certain steps.
Kate, just in general Mississippi, childbirth, many issues, high mortality rates or whatever, lack of OBGYNs, lack of many different services. One group argues midwives can kind of fill in their help and everything. On the other hand, physicians are like, you need to leave a lot of this stuff up to us. That's kind of been a perennial battle, hasn't it?
Yes. So advocates of this legislation and just expanding even certified nurse midwife, the use of certified nurse midwives, which are, they are in hospitals, they work under the supervision of an OBGYN. We have a couple hospitals in the state right now that use CNMs. But the advocates of this licensure program for the professional midwives say this increases choices for mothers who may want other options besides the traditional OB-led birth in a hospital.
Sure. And this same kind of debate is going on with has been going on, including right now, just scope of practice for nurse practitioners. Once again, that's an issue this session, is it not?
Yes, there's a bill I know over on the House side that would CRNAs. It would remove the requirement that they operate under an anesthesiologist. And again, proponents of this say we have a shortage of providers. These are mid-level providers that could help address needs, people's healthcare needs that don't have access to a physician. Opponents, a lot of physicians say there's a reason we did the amount of training and education we did. And
given the amount of ads I'm hearing on radio and TV, physicians are not
they're
for
not
this,
a fan, right?
Particularly with CRNs.
Correct. Yes. And then there's another kind of little interesting thing that I personally have not heard about before, but it may have come up before, is they're also talking about allowing anesthesiology assistants to become licensed in Mississippi. And that is another type of mid-level provider that other states have that Mississippi currently does not. And I believe there's a school trying to open a program for anesthesiology assistants. And so that's sort of another tangential part of this discussion.
We'll shift gears to something that we've seen a lot of debate on, Gwen. A lot of maybe interest. Kratom is back before the legislature this session, correct?
It is back. And
okay.
It's hot. There's 4 bills that have made it out of committee.
4 bills?
4 bills.
Okay.
Yeah, we've got many different proposals. There's kind of no consensus about the best way to regulate kratom, but there does seem to be a lot of interest in regulating it.
Sure.
There's 2 bills that would schedule it as a controlled substance. That would be
essentially ban it.
Essentially banning it and creating criminal penalties for possession. And there are 2 bills that would make it a 21 plus product. So you would have to get it, from behind the counter, and you'd have to show ID.
Currently, so the debate is gone, some of this stuff is being sold like in convenience stores and online. And
yeah, it's sold in most gas stations and vape and tobacco shops across the state.
Okay. And you said one measure would just require you to be 21.
And that measure actually passed the House last night. So that's the first one to come up. But Representative Yancey, who authored that bill, said he would also bring the other proposals to the floor.
Now, I've heard this argued for a couple of years at least. Proponents of kratom, so to speak, say it's less dangerous, would lessen maybe opioid addiction.
That's right. People argue that there are benefits of kratom. Some people say it can be used for chronic pain. It can help people who are struggling with opioid use disorder and even depression.
And then on the other side, others say it's like you're buying opioids in a gas station, basically.
Exactly. It's highly addictive and dangerous. And State Health Officer Dan Edney has actually come out and said that he supports scheduling the drug as a controlled substance.
Okay. This argument's going on in other states, right?
It's going on across the nation, yes.
We could probably be here all day with other health issues going on. Kate, are there any others you would like to mention right now? Or?
Sure. There's one I've been following. It's a requirement that has passed the full Senate, I think, as of 2 days ago. And it would require that insurers pay for coverage of postpartum depression screening, and would also do away with something called step therapy protocol, which is where insurance companies will require a patient to try a certain type of lower cost drug and have it fail before they will agree to cover a more expensive drug that the doctor might have initially recommended for the patient's treatment. And the argument, is that we have some of the worst maternal mortality rates in the nation, and as we all know, a leading cause of maternal mortality is mental health issues. So the argument is that, it's a time bomb, and if you're going to require someone to go through 4 weeks or whatever of a drug and wait to see if it works, and it doesn't, then you're kind of putting that person at a higher risk than they need or is safe. So that is really sailing through the Senate. I'm not sure how it's going to do on the House side. But
I'm assuming there are some probably powerful lobbies interested in this. Pharma, insurance.
There are. There's one of the lobbyists pushing that. I did see that one of his clients is Sage Therapeutics, which is the maker of a new postpartum depression drug that is quite expensive.
Well, you guys have been doing a really good job, the health team just in general. And like I said, there are so many issues. Even should Medicaid expansion not really heat up this session, still a lot of big measures going through. The CON thing, that's huge. That could have impact down the road. So I urge everyone to read Mississippi Today and the good work of our health team, and appreciate you guys joining us.
Thanks for having us, Jeff.